I'm Grace Halsey, Senior Editor of Patient Care Online, website for primary care physicians. And today I have the true pleasure of speaking with Dr. Brian Lima. Dr. Lima is Surgical Director of Heart Transplantation at North Shore University Hospital in Manhasset, New York, and Associate Professor of Cardiovascular and Thoracic Medicine, Thoracic Surgery at the Donald and Barbers Upper School of Medicine at Hofstra Northwell. Welcome, Dr. Lima.
Thank you. Thank you for having me.
So the COVID-19 pandemic has significantly strained every aspect of healthcare in the United States and has really stretched the physical and emotional capacities of every professional who delivers healthcare. As a cardiothoracic surgeon and also as a surgeon who has been on the front lines of and seen the close up the manifestations of the virus, and particularly in the ICU, can you tell us a little bit about what that experience has been like?
Well, I could say it's run the gamut, the full spectrum from being surreal, scary, disheartening, stressful. We saw all of our ICUs essentially, or nearly every single one of our ICUs converted into COVID units. And every single physician, regardless of specialty, become COVID doctors and sort of repurposed into serving the greater role, the greater mission, to take care of these patients. And from our department specifically, we basically volunteered essentially to cover our own, what used to be our heart surgery ICU, and cover what was now the largest COVID ICU in the entire hospital, 23 beds. And so all of the patients in that unit were critically ill, intubated with COVID. Some of them also on ECMO support, advanced life support that we had placed. So and that was it. We covered it around the clock and for a good solid month. And then as we were starting to get on the other side of this, of the peak, so to speak, of the pandemic in our area, the epicenter, we're now slowly inching our way back to normalcy. Now our unit's back to being a cardiac surgery ICU. So, but we were there sort of in the thick of it. It was very challenging.
How did you find the rapport and the, I guess, corps d'esprit of your fellows during this time? Was everybody all hands on deck no matter what? And how was it to sort of work with an ad hoc team day to day?
I was very, I guess this was, there's nothing really to compare this to. There's no experience that I could draw on to say that's what I was expecting, but I was surprised by just the sheer courage that everybody exhibited, stepping up to the plate, doing whatever was necessary to take care of patients. And so we really worked great as a team. We have a very close-knit team as it is. We're like a family, and we just basically pivoted and became COVID doctors. Our physician extenders also, effortlessly pivoted towards that, and our nurses too. So we're accustomed to taking care of critically ill patients. These were just different kinds of critically ill patients. I would say largely, respiratory illness, advanced respiratory disease. But we really did pull together and helped each other out. And because, as I'm sure we'll get into, at times, this was, many of these patients did not unfortunately do well. We had some saves, of course, but day in, day out, and seeing not much in the way of progress in many patients was tough. And having, these patients to weather that by themselves with no family also added that extra level of, it was just made it that much more tragic. And it was just nothing we had experienced before.
It sounds to me as though even the most experienced and stalwart of surgical hearts and physicians really were really affected by this. You hear it in the voices on the news, in interviews. It seems as though it's been an experience like no other, I think, as you've said.
Absolutely. Having to share, because family's not around because of limited, visitors or no visitors, having to explain to them that their loved one is not doing well, not progressing, and having to carry on this just difficult discussion over the phone, without them having, it's one thing for them to be at the bedside and they could see, and as is customary, but that wasn't really possible in these situations. And so it was that much added stress on the family member side, not really being able to understand or comprehend the magnitude of how gravely ill these folks were. So that added a whole new dimension to things that many of us struggled with.
In terms of the types of patients that became gravely ill that you saw in the ICU, was there a range? Was it predominantly older people with comorbidities, underlying frailties? Did you see any people who were relatively on the younger side and maybe had been healthy up to that point? Or was it a fairly predictable profile?
We were surprised also, meaning I would say the majority of the patients fit the profile of older with cardiovascular comorbidities like hypertension, obesity, diabetes, things like that. But there were also a significant number of patients that were young, 40s, 30s, sometimes even in their 20s, with really no identifiable pre-existing conditions that could explain why they would have been so severely impacted with COVID. That was surprising, but a good number of the patients did have the classic comorbid conditions that have been written about and presented elsewhere.
How about the cardiovascular system in general? I mean, it's basically a severe respiratory syndrome, although there's been an awful lot of press in the science news as well as the lay press about the cardiovascular impact, about hypercoagulability, thromboembolic events leading to death. What was your experience there?
Well, obviously, it did impact the respiratory system in a very, very big way, but we also appreciated the impact on the cardiovascular system. Many, or the vast majority of these patients, particularly the ones that had severe COVID, meaning they were critically ill, required admission to an ICU or intubation, had dramatic elevations in inflammatory markers, in their even cardiac markers, indicative of some heart injury. We know that from our experience and the experience of others, that these patients did exhibit some hypercoagulable type of phenomena. We saw it, significantly elevated D-dimers, spontaneous DVTs, pulmonary embolus, even coronary occlusions. So we did definitely see the sequelae of the hypercoagulable state and how it manifested in the vasculature. We also saw a couple cases of direct myocardial injury, so new onset cardiomyopathy, patients with heart failure. And then, of course, we had, we have a heart transplant program. We have an LVAD program. So folks with advanced heart failure who've been treated, they also, a few were impacted, and that also set them in, a few of them into a tailspin. So we can definitely attest to it impacting the cardiovascular system in a big way.
For those who have recovered, I'm thinking about our audience of primary care physicians who more than likely have had a patient in the hospital, perhaps even have lost a patient or a patient's family member. Are there, going forward in the wake of the pandemic, are there signs that physicians should be alert for in patients who have recovered from the disease in terms of cardiorespiratory effects, cardiovascular effects, maybe even metabolic effects?
I think we are, only beginning to understand and see some of these things, because I like to look at it as we're in the second wave now. We've experienced the acute sort of hospitalization phase, and now we're starting to see and hear about more sort of delayed onset sequelae like strokes or other indicators that this hypercoagulable state may linger for some time. So really, and the jury's still out, is, for some of these patients that we took care of, how long do you keep them on anticoagulation? When is it okay to stop? What, do we keep surveilling their markers to see if they're still exhibiting elevations in their D-dimer and other things? So I think we're all sort of walking on eggshells. We're still just being extremely cautious. And I would say from a primary care perspective and seeing some of these patients, I would urge the same thing, just being careful, maybe checking some markers and seeing if there's any evidence that this state may be still lingering, having a low threshold to refer to anyone in vascular medicine and things like that to see if, for ongoing surveillance as well, ultrasounds of extremities, things like that. So I think we just all have to, as physicians in general, across all specialties, learn as we go, and hopefully as more and more literature emerges that will help provide some formal guidelines, I think we just have to exercise extreme caution.
So in addition to a wide range of scientific material that you've published, you've also written a number of books on perseverance and resilience, or written a lot on perseverance and resilience, both your own and how those qualities work in the world at large. Would you talk a bit about your hopes for the healthcare world in general as we go forward from this pandemic? What are some of the lessons, at least at this very early stage as we move forward, that we can take from it?
Sure. One, if there is any silver lining at all here, it's hard to find one. But one thing I will say, it was comforting to start to finally see some positive headlines about physicians. For forever, right? All we kept seeing were, highlights of some of the negative things, physician burnout rates, which are all things that are occurring, but it was rarely the positive, feel-good story or success story. It was largely geared towards the negative. And now, physicians, I think, could feel that actually we are appreciated. People do appreciate what we do. We stepped up and did what we swore we would do, right, when we took our Hippocratic oath. So it was really nice I think many physicians can feel comforted that, they are in this for the right reason. And I think in the crazy, complicated world of medicine, sometimes it's easy to lose sight of why we signed up for this. And I hope maybe the pandemic helped us realize what it was. It's for moments like this to help people. And the public appreciates that. And I think maybe we can hold on to that and remember that as things slowly migrate their way back to whatever the new normal is going to be, but not to lose sight of what it is that we do and appreciate that. And maybe that can help alleviate some of the real world stresses that we face as physicians in the complex system we practice in.
Very good. Thank you very much for your time.
Thank you.
Grace, that was a great interview. Thank you. Now, I know we are all eagerly awaiting news from Infection Control Today, which continues to share the latest on the COVID-19 pandemic. Frank Diamond is here now to report the updates and share an interview with Kevin Kavanaugh. Take it away, Frank.